Imagine you had the power to recognize the earliest whispers of cancer before it became life-threatening. Today, I'm sharing the signs of cancer that are often missed but could be life-saving. And here's why this matters. A few years ago, a patient's family asked me a question I'll never forget. Were there any signs we missed? That question changed me. What if they had known what to look for? What if you do? Stay with me as we uncover the hidden signs your body may be trying to show you. I remember the day clearly. My patient, who seemed perfectly healthy, had only complained of occasional fatigue and mild weight loss. Things many of us would dismiss as stress or diet changes. But beneath the surface, cancer had been developing silently. By the time we discovered it, it had spread. And the family's first question was heartbreaking. How did we not see this coming? That moment taught me something. Cancer rarely hides without leaving clues. But these clues can be subtle and easy to ignore. That's why today's video is about awareness. Because noticing the early signs can be the difference between life and death. Our bodies are made up of about 37 trillion cells. Each of these cells follows instructions that tell it when to grow, when to stop growing, and when to die. It's like a well-orchestrated symphony that keeps our bodies functioning smoothly. Now, when cells die, new ones take their place. But with cancer, this balance is disrupted. A cell mutates and starts growing uncontrollably. And here's the problem. It refuses to die when it should. Imagine a garden where a single weed refuses to stop growing. It begins taking over other plants, and before you know it, the garden is overwhelmed. That's what happens when cancer cells invade nearby tissues and spread to other parts of the body. Globally, cancer is one of the leading causes of death, with millions of new cases diagnosed each year. But there is hope. Advances in early detection and treatment mean that many cancers are now survivable if caught early. Take breast cancer for example. Thanks to mammograms, survival rates have dramatically improved when it's caught early in the early stages. But not all cancers have such clear screening methods. Sometimes recognizing the subtle symptoms is the key. Now that you understand what cancer is and how it can silently grow in the body, let's talk about the early warning signs you should never ignore. These aren't always the dramatic symptoms you see in movies. They are often subtle, easy to miss, and sometimes feel like things you'd normally brush off. But it's exactly those small changes that can hold the biggest clues. Let's dive into the 10 hidden signs of cancer, starting with the one that many people overlook. Suddenly losing weight without trying could be a red flag. If you've lost more than 5% of your body weight in a few months, say 4.5 kg, which is about 10 pounds, without any changes to your diet or exercise, it is worth investigating. This could look like your clothes feeling loose or friends saying you've lost weight. But it's not a reason to celebrate if you weren't trying. Cancers of the stomach, pancreas, and lungs are often linked to this symptom because they can speed up your metabolism and cause your body to burn through fats and muscle. Now, weight loss might be one clue, but fatigue is another warning sign that often gets dismissed. Let's talk about that next. We all get tired, but this isn't your usual end of day exhaustion. Cancer-related fatigue doesn't improve with rest. It's the kind that makes even small tasks like climbing stairs feel like a marathon. It can happen when cancer triggers chronic inflammation or when your body is producing fewer red blood cells, limiting the oxygen available to your muscles and organs. If you find yourself needing frequent naps or struggling to stay awake during daily activities, it's time to listen to your body. Fatigue can sometimes come with another hidden clue: persistent, unexplained pain. Let's look at how that could be a warning sign. Pain that doesn't go away, especially if it is dull, aching, or located in the same area, could be a sign of something serious. Tumors can press on nerves, bones, or organs, causing persistent discomfort. For example, back pain that doesn't respond to rest or pain relievers could be linked to pancreatic or kidney cancer, while bone pain that lingers could signal bone cancer. While pain can be a noticeable sign, sometimes the warning comes from changes you see on the outside, specifically on your skin. Skin cancer doesn't always start as a mole, but new or changing moles are often a warning sign. Look for moles that grow larger, change color, or develop uneven borders. Think of it this way: if a spot on your shirt keeps getting bigger, you'd inspect it, right? The same goes for your skin. Any mole that bleeds, itches, or changes in texture should be checked by a dermatologist. But skin isn't the only place where the body can send visible warnings. Let's talk about unexplained bleeding. Seeing blood where or when it shouldn't be is always a warning sign. Blood in your stool or urine or coughing up blood could indicate internal damage caused by a tumor. For example, blood in the stool may signal colon cancer. Blood in the urine could point to bladder or kidney cancer. Coughing up blood may be linked to lung or throat cancer. Blood from the nipple may indicate breast cancer. Also, bleeding through the vagina in a woman who had stopped menstruating previously may be cervical, endometrial, or even though rarely, ovarian cancer. If you see blood once, monitor it. But if it happens more than once, don't wait. Get it checked. A persistent cough or hoarseness could be connected to some of these same cancers. Let's take a closer look. A lingering cough or hoarseness that lasts for more than 3 weeks could be related to lung or throat cancer. This isn't your typical cold or allergy cough. It is persistent, worsens over time, and may be accompanied by wheezing or shortness of breath. Pay attention if you notice your voice becoming hoarse or if your cough doesn't seem to go away. Now, let's move on to a symptom that many people mistake for simple digestive issues. Having trouble swallowing or feeling like food is getting stuck could indicate a tumor in the esophagus or stomach. Chronic indigestion, bloating, or unexplained nausea are also red flags. Don't assume persistent digestive discomfort is just heartburn. If it doesn't improve with diet changes or over-the-counter medications, please consult your doctor. Now, let's talk about the lumps or swelling that you can feel under your skin. A new or unusual lump under the skin, especially in the neck, armpits, or groin, could be a swollen lymph node. Lymph nodes typically swell when the body is fighting infection. But if the swelling persists for more than a few weeks, it could be related to cancer. Pay close attention to lumps that grow or feel hard to touch. Persistent fevers or night sweats without an obvious infection could be linked to cancers like leukemia or lymphoma. If you are waking up drenched in sweat or experiencing low-grade fevers regularly, it is worth discussing with a healthcare provider. Sudden changes like constipation, diarrhea, or frequent urination can be signs of an underlying issue. For example, needing to urinate more frequently or feeling like your bladder doesn't fully empty could be linked to bladder or prostate cancer. Persistent changes in bowel habits could indicate colorectal cancer. If these changes last for more than a few weeks, don't ignore them. Here's the bottom line. The symptoms we discuss don't automatically mean you have cancer, but they are your body's way of sending you a message. Don't ignore it. If any of these signs persist, please see a doctor. Early detection could save your life. And here's something important. Awareness isn't just for you. By sharing this information, you could help someone else catch cancer early and improve their chances of survival. Remember, your body is always communicating with you. The more we listen, the better we can protect our health. So don't be afraid to ask questions or seek medical advice, because early detection truly saves lives. If you found this video helpful, please give it a thumbs up and share it with your loved ones. I'll be posting more health-related content to help you stay informed, stay healthy, and take charge of your well-being. Subscribe and follow so you don't miss future videos. Your health and the health of those you love could depend on it. And before you go, I'd love to hear from you. What's one health symptoms you've ignored in the past? Share it in the comments and let's learn from each other.